2.5 years of Israel's genocide in Gaza have left a healthcare system on the brink of collapse. Not a single hospital in the Strip is fully functional. More than 90% of health facilities have been either damaged or completely destroyed. On day 2 of our series, Gaza Promises and Reality, we're looking at Israel's systematic destruction of clinics and hospitals. We'll report on the stories of those who depend on life-saving medicines that they just can't access. Over now to Tarek Abu Azoum and the team in Gaza.
Thank you so much, Tom, and welcome to our special coverage live from Khan Yunis. I'm here at Nasser Hospital, the largest in southern Gaza, and the lifeline for thousands of people here. But like most hospitals across the territory, it's partly functioning. Most health facilities have been damaged, destroyed or put out of service. Israel from its side is still heavily restricting the entry of goods into the Strip, putting life-saving medicines out of reach for many. My colleague Muad Al-Kahlout met families of the children with type 1 diabetes who are struggling to find insulin.
This is Amir.
بدي أسألك موجود أنسولين نوع جديد تاريخ جديد.
She's searching for insulin for her 10-year-old son Amir, who lives with type 1 diabetes in Gaza. She returns home empty-handed each time, carrying the worries of her son. With expired test strips, she tests her son's blood sugar twice a day. And each time, the result is alarming. The test strips aren't the only thing that has expired. The insulin itself is also past its date.
I suffer with Amir. The insulin is expired and the test strips aren't available anywhere in the country. We go out searching for test strips and insulin, but they're nowhere to be found. And if they are, they're too expensive.
For Naveen Haboush, every day she gets through without fainting from low blood sugar is a victory. Her mother goes over her lessons with her once she's back from school. But there is one important lesson, the lesson of healthy eating, what to eat and what to avoid. Her mother is constantly in a state of panic because expired insulin is her only available option. Playtime is limited to just 1 hour indoors, since Naveen's body is very weak and she tires quickly, so she can remain under her mother's watchful eyes.
I worry about her a lot, especially when she goes to school, because expired treatment is not effective at all. When she leaves, I wait for her at the door and keep reminding her, if you feel anything, tell your teacher.
Doctors warn that the risks of using expired insulin can be life-threatening. At Arlantisi Children's Hospital, Dr. Jalal Al-Barrawi is concerned about children with type 1 diabetes and the risks of using expired insulin.
Pediatric endocrinology and diabetes specialist, the complications of using expired insulin may include a sudden rise in blood sugar or increased acidity in the body, which can be severe enough to require admission to the intensive care unit.
For many families here, every injection has become a question of survival rather than recovery. Parents wander from one pharmacy to another, chasing insulin and test strips that have vanished, while diabetic patients are left navigating survival, uncertain if they will embrace the next day or not. Muad Al-Kahlout, Al Jazeera, from Gaza City, Palestine.
Israeli strikes have systematically destroyed Gaza's healthcare system. Hospitals have been repeatedly hit. Doctors and medical workers have also been deliberately targeted. As Kulthum al-Sharif explains, a ceasefire agreed to last October has not stopped the killing of health workers.
Under international law, targeting hospitals is a war crime. But since the start of Israel's genocidal war on Gaza, it has directly and systematically targeted healthcare infrastructure across the Strip. The first was a massive explosion at the Ahli Hospital in Gaza City in October 2023. The Palestinian Health Ministry said 500 people were killed and hundreds injured. Israel denied it, blamed Hamas, which denied the accusations. Since then, the Israeli military has gone on to strike hospitals and medical facilities in northern, in central, and southern Gaza. The strikes have forced critically ill patients out on the streets. In August last year, a double tap strike at the Nasser Hospital in southern Gaza killed 20 people. Among them were 5 journalists, including one who worked for Al Jazeera. The Israeli military has also laid siege to several hospitals and held medical staff and patients captive. In one such raid at the Kamal Adwan Hospital in December 2024, it arrested its director, Dr. Hussam Abu Safia. He's been held for more than 500 days without formal charges. He appeared before the Israeli Supreme Court on June 10th through a video conference. Now, ambulances and aid convoys have also been targets. In March last year, the Israeli military hit a humanitarian convoy and rescue team in southern Gaza, killing 15 aid workers. The Palestinian Health Ministry says 1,700 health workers have been killed since the start of the war. Now, Israel is also blocking medical aid into Gaza. Now, medicines, equipment needed for surgeries, even anesthesia has been blocked. Now, despite the ceasefire, the ongoing border closures that we are seeing, and also the logistical problems and a ban on important charities has left hospitals with critical shortages. Currently, of the 38 hospitals and nearly 160 primary healthcare centres, a little over half are functioning, but none of them are able to operate at full capacity.
According to Gaza's health ministry, almost 21,000 people should have been allowed to leave Gaza by now. That's what was promised in the US-led ceasefire deal agreed in October. About 1/3 of them were meant to be patients in need of urgent medical care, along with 2 companions each. In reality, fewer than 7,500 people have been allowed to leave in total. That is a compliance rate of just 36%. Today, tens of thousands of people have been cleared for urgent evacuation, are still trapped in Gaza. Many won't survive. Dr. Ahmed Al-Farra is the head of the pediatric department at Nasser Hospital, joining me right now in the studio to get a critical reading of the medical reality that they have been going through since day one of the genocide versus what has been promised to be taking place during this ceasefire and the first phase of it. Thank you, Dr. Ahmed, for joining us today. We know that you have been operating at Nasser Hospital since day one of this genocidal war, and you have been responsible of providing medical care for dozens of patients on a daily basis. Could you tell us more about what seriously has changed after nearly 3 years of genocidal war in Gaza in the health of Gaza's children?
Really, first, thank you for having me and give me this opportunity to talk about the situation in Gaza. After 1,000 days of this offensive war or criminal war, it is not something like a series of criminal crime against Gaza. No, it is something targeting the human existence foundation, something we called it or term it health genocide. They attacking the health sector. As you can see, they tried to turn the hospital into concrete of shells. It's out of services, out of medical supplies, out of doctors. They targeted everything in the hospital because they used to target the human existence itself. What the difference between now and before the war, we can talk a textbook about that. Let's start with the beginning of the cycle. When a woman, she is displaced from a place to another place. She wants to be pregnant, she's a wife. Unfortunately, she doesn't have the opportunity to have this pregnancy. There is no privacy. She displaced from place to place. If she's pregnant, and this is unfortunately decreased the number of fertility among the war in Gaza, unfortunately this baby will be weak. He has the chance for, unfortunately, for stillbirth, for congenital malformation, for intrauterine growth retardation, for premature baby. Why? Because she don't have the vitamins, the supplement. She doesn't have the suitable water. She doesn't have the suitable food. She's undergone famine. She's under psychological, severe psychological disturbance while evacuated, while displacement, while attacking here or there. And when she wants to come to the hospital, she doesn't have the transport to come to the hospital.
Dr. Ahmed, you made a very good point regarding the lack of medical supplies. From your own perspective, how could Gaza's hospitals now, what's left of it, could continue providing healthcare services amid these shortages?
My friend, we expect by this fake ceasefire that everything will be changed. But I'll tell you, and I swear about that this period of time is the more worst period of time among this 1,000 days. That means we expected that a lot of medical supplies to come inside Gaza, but unfortunately this didn't happen. For example, for just one example, the diabetes mellitus patient or child, they don't have the insulin. It is the hormone of life for them. They don't have the kits for examining the blood glucose. They don't have the HbA1c. Today we have meeting in the morning. We don't have the arterial blood gases for the pediatric ICU. We don't have electrolyte for them. We don't have the real CBC. We don't have a lot of investigation. If we visited the orthopedic section, we don't have the infra and internal and external fixation.
Absolutely.
A lot of surgeries are stopped in Gaza. Even the hemodialysis is stopped by 50% because of lack of equipment and lack of instrument.
Absolutely, it's a very disturbing reality. Thank you so much for joining us on Al Jazeera. Absolutely, as Dr. Ahmed mentions, it's a very disturbing reality. Now, access to treatment for heart patients is increasingly difficult. There's only one specialist cardiac machine that is still basically operating in Gaza. And as my colleague Hind Al-Khudr reports, it's an anxious wait for hundreds of patients in need of urgent care.
A racing heartbeat, chest pain, a blocked artery, and the growing fear that help may not arrive in time. For heart patients in Gaza, each day brings new uncertainty. Inside the Palestine Red Crescent Society Al-Quds Hospital, doctors are fighting to save lives with very limited resources and only one catheter machine. But the machine alone is not enough.
This is the only catheterisation machine currently working in Gaza. For the past 6 months, it has played the main role in saving the lives of heart patients. But if the patient arrives and we don't have the necessary supplies or equipment, we cannot treat them. We have to refer them abroad, and we don't know whether they will survive long enough to receive treatment. I expect many patients may deteriorate and die while waiting.
But the challenge goes far beyond a single machine. Specialist equipment like stents and contrast dye are all critically scarce. Without these essential supplies, many life-saving cardiac interventions simply cannot be performed. Doctors say they're forced to prioritize only the most urgent cases. At least 500 patients are on waiting lists for cardiac procedures, with many waiting weeks as their conditions worsen.
I'm afraid I will have a stroke while waiting for my operation. I asked for a catheterization procedure, but they told me they don't have the supplies and that treatment is only available outside Gaza. I cannot leave Gaza. Thousands of people are waiting. By the time my turn comes, it may be too late.
For those on the list, every passing day brings more risk and uncertainty. Until additional supplies arrive, doctors say they're left making difficult decisions. Behind me is Gaza's only functioning cardiac catheterization machine. For thousands of patients here, access to this room means the difference between life and death. هند الخضري, Al Jazeera, Gaza, Palestine.
Cancer patients are struggling to survive the conflict and their illness. One 30-year-old mother has been undergoing chemotherapy while being displaced and struggling to find food. She dreams of the day she can leave to get the care she needs abroad. Here is her own story in her own words.
اكتشفت المرض هذا كانت أثناء الحرب. أجتني أعراض إن أنا تعبانة وهيك ومناعتي ضعفت وبمرض من أي إشي وتعبت كتير. اكتشفوا عندي إنه عندي كتلتين بالثدي ورم. فإنه حكوا لي إنه هذا أنسجة مش باين عليها إشي مش منيح يعني، فلازم تاخدي عينة منها. أخذت عينة طبعاً بصعوبة، كانت الدنيا حرب وبصرف ورحت على الدكتور كذا مرة عشان ألاقيه وين موجود، إنه الدنيا نزوح ودنيا تشريد وهيك. وبلشت أخذ جرعات كيماوي. الجرعات الكيماوي أخذتها كان عز الحرب والمجاعة. والله العظيم أول جرعة أخذتها إنه قررت أخذها يعني وأخذتها، والله ما كان في رغيف خبز. والله العظيم كنت أروح على الدكتور فيش يعني جسم هيك، كان وزني كتير 40 كيلو كان وزني. كنت أروح على الدكتور أخذها مش مستعدة إني آخذ الجرعة، كان الدكتور يحزن علي يعطيني محلول إشباع إني عشان أقدر أتحملها. ولا كان في أكل ولا إمكانيات ولا في علاج، حتى الميبرازول كنت يعني دايما يوفروا لي إياه بالمستشفى. كان الدنيا حرب يعني، صعب الأدوية تكون موجودة وهيك. خلصت 8 جرعات على الحال، وحتى أخذتهم مش كل المستشفى الحلو الدولي، أخذتهم في أغلبهم كنت نازحة متشردة. والله رحت نزحت من هان من مدرسة أسمى، نزحت أجل اليهود عندنا هان، نزحت من هان للمواصي مشي. والمكان اللي أنا عايشة فيه مش ملائم بالمرة لعيشتي. عندك في أنت عارفة إني قصدي روائح، أشياء نار، ريحة مجاري، أشياء بس بقدرش. والله لسه إني قبل شوي عملت استفرغت من ريحة إشي هب هيك، يعني عايشين عند بركة هيك، المكان مش ملائم. وغيرك بتمنى إني أنا أطلع أتعالج، لأنه الدكاترة فهموني إنه أنا أمانة طول ما أنت بتغذى رح تضلك تاخذي جرعات كيماوية ولما تسافري. بحكي لك أنا طول ما أنا بغذى، أنا علاجي برا، إنه في أجهزة خاصة فيا، نظام فوكس إيش للكتل، مسح ذري، إشعاع، هذه الأشياء حكى عنها الدكتور. بيحكي لي أمانة أنت طول ما أنت عندي أنا هضل أعطيكي كيماوي عشان هذه الأشياء مش موجودة عندي، خوفا ما يصير عندك انتشار جميع أنحاء الجسم. بتمنى إني أطلع بأسرع وقت أتعالج وأرجع لأولاد وأرجع أمانة أنا الأولانية. بخاف من الموت، بخاف إني أموت وأترك أولاد، بخاف.
That's it from me, Tariq Abu Azzoum, and the team here in Gaza. On Tuesday, we will take a look at the social reality of life in the Strip. For now, it's back to Doha.